talking about BabyChakra. It's a platform which talks about parenting, pregnancy, and makes lives easier for new parents. Today, we are talking about a very interesting topic, a very important topic, in fact, which is exercising the right way during pregnancy. And to help us know more about this topic, we have with us three amazing panelists with us who are experts in their fields. So, to begin with, I would request Dr. Manasi to introduce herself to everyone.
Hi, I'm Dr. Manasi Wadekar. I'm a fertility expert, obstetrician and a gynecologist, and a high-risk pregnancy consultant from Surat.
Okay. Thank you, Dr. Manasi. Dr. Anuradha, would you please introduce yourself?
Hello, I am Dr. Anuradha Tikhe. I am a homeopath and prenatal yoga consultant. I am the founder of Ankur Yoga, which is a platform for prenatal and postnatal yoga. Thank you, and I am from Pune.
Thank you. Uh, Dr. Shail, we would request you to say something about yourself.
This is Dr. Shail. I have been working as a senior physiotherapist in Delhi and a women health consult classes of antenatal and postnatal fitness coach in Delhi only. Thank you.
Thank you, doctors, for your introduction. Now we will go ahead with the live, and we have few questions which we'll take forward. So, our first question is for Dr. Manasi, and the question is, what is the best way to exercise while pregnant?
See, actually, there is no good or bad way to exercise, but I think, swapping away all the misconceptions, pregnancy is a good time to exercise. And if you are healthy and your pregnancy is normal, your gynecologist can decide whether your pregnancy is normal or complicated. You with a normal pregnancy and a healthy body, you can definitely go ahead and start exercising or continue exercises which you have been doing when you were non-pregnant. But just you have to keep in mind that the changes that pregnancy uh, brings to your body, there are two three things. One is your joints. Aapke joints, they become more lax because of the hormones, so they are more prone to injury. इसलिए बहुत high impact sports नहीं खेलना है आपने. Second is your balance, because आपका center of gravity shift होता है as your pregnancy grows. इसीलिए anything that may make you lose balance is to be avoided. Third is your breathing. आपका ऑक्सीजन रिक्वायरमेंट ऑलरेडी बढ़ा हुआ होता है ड्यूरिंग प्रेगनेंसी, so anything very strenuous on your body is not advisable. A simple way to determine that is, if you can talk while you're exercising, that is fine, but if you start getting breathless and cannot talk while you're exercising, that means you're going too far. So to say it shortly, listen to your body and listen to your gynec before you start exercising.
Sure. Thank you, Dr. Manasi. We have another question, which I would request Dr. Shell to take it up. So the question is, what are the do's and don'ts of exercise during pregnancy? And are there any specific exercises for each trimester that you would recommend?
Exactly. Of the American Association of Obstetrician and Gynecology and under the instruction of the gynecologist to see what are the important exercises to be performed in which trimester. First of all, it is Dr. Mansi as well. Okay, we can't perform exercises during pregnancy. It is not like that. We can perform a basic guidelines in which in every week we should have a basic 30 minutes walk. There is a combination in which you should not go breathless. You should maintain your body rhythm. You should be on your body level, as like if you are having a very sedentary lifestyle, आप daily कुछ भी ऐसा कुछ नहीं कर पा रहे हैं, so you are not having to do strenuous activities. Okay? If you are getting pregnant, forget you are performing or straining your body more. For that, you have to decide what kind of exercise trimester. First of all, 26 till 26 week of pregnancy, Dr. Mansi will suggest 6 week of pregnancy, the exercises is restricted. Only will focus on the Kegel exercises part, exercises and breathing exercise. Post 26 weeks, we will focus on the normal breathing techniques and the labor preparing exercise and the birthing exercises, which will carry out forward in the and the third trimester.
Sure. Thank you, Dr. Shail, for your insights. Now, I would like to ask Dr. Anuradha another question, which is what exercises should be avoided while pregnant?
Okay, so we can do exercise during pregnancy, but there are few exercises which need to be avoided. They are like first is like bending forward. Any exercise which need bending forward, like Surya Namaskar, or any yoga asana, or any exercise which need bending forward, because it put pressure on your abdomen. So avoid that thing. Then second is uh, any exercise which or any workout which increases your breathing or which increases your heartbeat, so that need to be avoided, like running fast or dancing fast. If you are swimming, then swimming, even swimming fast can increase the breathing and everything. So avoid that thing which causes your which affect your breathing and your heartbeat. Then also you should avoid exercises which in which you have to lift up weights. So all type of weight lifting should be avoided completely because it put pressure on your abdomen. So that thing should be avoided. Then any exercises in which you have to sit up straight, so like push ups ho gaya ya fir uh, sit ups ho gaya, so that thing to be completely avoided.
Sure. Thank you, Dr. Anuradha. So basically, the baseline is that um, before taking any new exercise or any strenuous exercise, we should ensure that we consult with an expert because, yeah, there might be, certain way the body responds to it. So rather than just doing it on our own, it's obviously at best to consult with the experts. Thank you, Dr. Anuradha, for your wonderful insight. Dr. Manasi, moving on, we would want you to answer this question, which is in which month should an expecting mom start exercise during pregnancy? So, is there?
So there is no time wherein you can start or you cannot start a pregnancy. You can start exercising in any trimester, but then your exercise has to be simple, safe, and doable. So as I said, listen to your body and listen to the experts. And trimester wise, there may be some changes that you have to bring to your exercise regime. First trimester, you can fairly continue if you have been doing something before, if your pregnancy is normal. And if you're starting new in the first trimester, go slow and steady. Second trimester, I would advise go for more low impact exercises like simple brisk walking or swimming. And third trimester, I would like that you add stretching exercises which help relieve the muscles of your lower back and strengthen the pelvic floor.
Sure. Thank you, Dr. Manasi. Dr. Shell, there's this question which is women with what medical conditions should avoid exercise during pregnancy? So, yeah.
Any kind of activity which are causing them the breathing difficulty, breathless, complicated pregnancy, like if they have a placenta previa or brevis, in which they have a placenta, they should be totally avoided to perform any kind of exercises. As in that, getting miscarriages, and if your previous health and you are getting a recurrent as well, seeing the family history, seeing the past history and the medical conditions are much clumsy, hypertension during your pregnancy, you should avoid doing the exercises. Breathing part, more breathing will bring more relaxation to your body. More relaxation will keep both calm, and that calmness will definitely bring the insights to perform more and relax the baby.
Sure. Thank you, Dr. Shell, for your wonderful insight. Dr. Anuradha, there is a question which is in which case should a mom stop working out during pregnancy? So,
Okay, so if a mother is working out, first thing she should keep in mind is like uh, listen to your body. As Dr. Mansi said, listen to your body and listen to your expert. So if she is working out and if she feel breathlessness, or if she feel her heartbeat is rising up, palpitation is there, or sweating is there, so she should stop the exercise at the same point. Like, she should not do it again ever. Then any exercises which causes her pain in her pelvic area, in her abdomen area, so that thing, that exercises should be avoided. If a lady is doing exercise and if she feel nauseating or dizziness or heaviness in her head, like even pranayam can also cause to some extent nausea and dizziness in the head, so you should avoid that thing. Then one Every lady should keep this in mind, like every pregnancy is different and every body is different. The need for her body is different. What other is doing, like if other is walking and she is walking, if she is having breathlessness, she should not do that. So keep in mind that your body is different, your each pregnancy is different, so your demand is different. So as per your demand of your body and as per your comfort of your body, you should do exercise. You should stop anything which causes pain, discomfort, breathlessness, palpitation, and sweating.
Sure. So, Dr. Anuradha, just adding to what you said, so you said that if there is sweating, one must avoid exercise, but just out of general, in exercise, there is some bit of sweating involved, right? So, where do
Abnormal
we
sweating, I
differ?
mean. You will
Okay,
sweat while you are walking, you are doing any kind of exercise. But if the
yeah,
sweating is more abnormal kind of sweating,
yes,
you can guess, you can judge it from your
okay.
daily sweating. If it is heavy, then you
Meals.
should stop.
Yeah, if there's like too much fatigue combined with sweating. Okay.
Yes.
Thank you, Dr. Anuradha. So that brings us to the end of the questions that we had, but there are a few questions from the audience. So, Dr. Manasi, I would like you to take this question, which is, what are the advantages of exercise during pregnancy?
Okay, talking of advantages, there can be a lot many advantages. Like, first of all, towards the end of your pregnancy, if you're um, regularly exercising, that can help you relieve your backache. It can also help relieve symptoms like constipation. Being a regular in regular activity, exercising also helps you not gain too much weight, and that eventually may help you in your normal delivery. If, pelvic floor muscles, strengthening your pelvic floor muscles can help you in your labor process also.
Sure, sure. Thank you, Dr. Manasi, for answering that. We have another question, which I would request Dr. Shell to take it. So, Dr. Shell, what are some of the red flags or warning signs which expecting moms must listen to while exercising? Although Dr. Anuradha did mention about sweating and all, is there something you would like to add to it?
Yeah, it will be dizziness, fatigue, and cramping in the leg may stop them to definitely to avoid any kind of if they also feel any kind of bleeding or restlessness during the exercise. Also, if they feel any kind of discomfort while lifting the weights, as they should avoid lifting the weights. But weightlifting is avoided, but lightweight exercises are total so that the muscle and body could get this much strength to maintain the lower their upper body muscles, because upper back strengthening is definitely needed during the, because in the pre-pregnancy as well we are preparing the body for getting the being a mother fit. That, that much care they can follow the thing in the post-pregnancy phase. If you feel any kind of bleeding, dizziness, fatigue, cramping, and palpitations, any kind of exercises to be performed during the pregnancy.
Sure. Thank you, Dr. Shell, for answering that. So that brings us to the end of the questions that from the audience. However, I would request Dr. Mansi to add in your closing suggestions or advice if you have.
A few tips I'd like to give is, stay hydrated always when you're exercising. Make sure you have water or hydration at hand. wear a proper fitting bra, or eventually in the third trimester you may also like to wear an abdominal belt to support if you want. And third thing is very important, that listen to your body. We have discussed about the red flags and what we should look after. And fourth is go slow. And if you're starting new, go slow and increase slowly as you go ahead. So
Sure. Thank you. Yeah. Thank you, Dr. Mansi, for those tips. Dr. Anuradha, is there something you would like to add?
Yes.
Yeah.
So while exercising, one must keep a few things in your mind. Like you should always use a mat while doing your exercise. It should be a proper yoga mat, because
Yes.
exercising on floor or any other mat, it may cause slipping of the mat or something like that. So use proper yoga mat. Then while doing standing exercise, you should take support. Okay, you should stand next to wall, or you should use one chair or something like that to hold on. You should hold on and then do your exercises, because at the in pregnancy the center of gravity shifted in front, so you don't know, you don't have idea about your, like, you may fall, or there are chances of some accident. So just to avoid everything, you should take support while doing exercises. And at the end, if you do exercise for full 9 months in your pregnancy will go very smooth. You will not face any issues like any digestive issues like heartburn, constipation, or anything. If you are doing your exercise on proper note, you will not get issues like pain or cramps in your legs. And at the last trimester, there are chances of getting breathlessness because of the increasing size of your belly. So if you are doing your exercise and if you are doing pranayam on regular basis, you will not face all those issues. So keep exercising, but listen to your body, and be very alert while doing it. Go very slow, take support and take help, and always take guidance. Do your exercise in front of proper therapist, so that you are guided very well.
Thank you, Dr. Anuradha. That was really helpful. I'm sure it's going to help all the expecting moms or even those moms who are planning to get pregnant. Dr. Shail, is there something you'd like to add?
Yeah, sure, definitely. As we know, कि many of the mothers are working from home. There's a very less we have talked about. कि in the working posture, the posture is performing the laptop work or doing the household jobs. So it is very in your ideal body weight along with your ideal body posture. Because in many cases, the weight of leaning forward on the laptop, doing the household, the work on the laptop while sitting, lying on the bed. So this is not the accurate posture while you are performing exercises. This will increase the pain, your pain and your muscle cramp. So that is why whenever you are working in the ideal posture of keeping your shoulders erect, while if you are not able to keep them out, okay, whenever we start doing on laptop, we definitely slowly come forward. So this is not the way. Taking some tips, or you have to start taking some stretching exercises in between your session. If you have a job of let's say 8 hours to 10 hours, you have a 2 hour break in every, like that only. You should always have to focus on some kind of stretching or desk job if you work from home. Also, always sit with your back supported, so that the spine that should not aggravate your lower back pain. Also, keep your foot always be supported on the air. It will increase the ankle swelling as well, and your cramping in the calf. Stretching exercises in between at least 2 times in a day. As mentioned, breathe. Breathing is the most important thing that will keep your body calm, and because a healthy mind always resides in a healthy body. That's how a baby good healthy mother as well. So that is why it is always needed to keep erect your body, support your body, you are getting happy with, not with the way it is a compulsion. Okay, yes, the therapist says I have to do that. No, enjoy this process. You have to enjoy each and every moment along with your expert performing the daily exercises routine as well as work. Don't stress yourself. Thank you.
Thank you, Dr. Shail. That was really helpful. Of course, like posture is something that we tend to like very overlook, especially when working from home, which is like the new trend right now. So yeah, it is really helpful for all the moms who are listening out there. Thank you, doctors. Is there anything else you'd like to add? Because that brings us to the end of the live. So if there's anything. Okay, sure then. Yeah, thank you. That brings us to the end of the live, which is exercising the right way during pregnancy. Thank you, doctors, for adding all your wonderful insights. It was really helpful and it was a very enjoyable interactive session. Thank you.